Welcome to my YouTube channel. I am going to upload the whole syllabus of anatomy for first year students including upper limb, lower limb, thorax, abdomen, pelvis as well as CNS. So our today's topic is femoral sheath. We have already started with the lower limb session. We will be studying the femoral sheath in three subparts, that is introduction, then formation, then its division. So let's start with the introduction. Femoral sheath, it is the funnel shaped sleeve of fascia which covers the upper 3 to 4 cm of the femoral vessel. So femoral sheath is nothing but it is a fascia which covers the femoral vessels, that is the femoral artery and the femoral vein of upper 2 to 3/4 cm of the femoral vessels. Not the full femoral vessels, only the upper 3 to 4 cm. It is formed by the downward extension of two layers of fascia of the abdomen. So, anterior wall is formed by fascia transversalis, which lies in the anterior abdominal wall deep to transverse abdominis missile. Anterior wall is formed by fascia transversalis, जो कहाँ पर होती है, एंटीरियर एब्डोमिनल वॉल में होती है, ट्रांसवर्स एब्डोमिनस मसल के डीप में. Second is posterior wall, which is formed by fascia iliaca, which covers the iliacus muscle. Inferiorly, it is merged with the connective tissue around the femoral vessels. So we can see clearly in this diagram, this is the femoral sheath. It covers the upper 3 to 4 cm of the femoral vessels, like femoral artery and femoral vein. So it is asymmetrical. Lateral wall is vertical, medial wall is oblique, downward and laterally. So we can see the lateral wall is vertical, medial wall is oblique, downward and medially. It is divided into three compartments by a septa. Lateral or the arterial compartment, in which there is femoral artery plus femoral branch of genitofemoral nerve. This is the lateral compartment, in which we have femoral artery plus the genitofemoral nerve. Intermediate compartment, also called as venous compartment, in which we have femoral vein. This is the intermediate compartment in which there is a femoral vein. Third is medial or lymphatic compartment, which is very much smallest and called as femoral canal. This is the smallest compartment, medial compartment or the lymphatic compartment, which contain a lymph node. So femoral canal I have explained in another video. If you want, you can go and check. So this was all about the femoral sheath. I hope you all understood the femoral sheath. It is a short and crisp topic, so it will be coming only for 5 marks in the exams. So if you want more videos like this, you can subscribe to my channel. Thank you so much. If you have any query, please go and comment in the comment section. Thank you.